Dr. Avinash, my next question is for you, where you pointed out something on the combination of medicine and counseling going hand in hand. So, how far do you think that medication really helps in the stability of the client? And also, we've experienced that many clients say, "Oh, I'm feeling better now, so मैंने medicine छोड़ दिया." So, how that is also obviously detrimental. And at what point do you suggest that the person then steps into the area of counseling along with this?
Well, I think, see, very acute cases or very severely depressed, or they are violent, or they're aggressive, or they're in that psychotic mode where they have no insight that they're ill. It may be very difficult at that time to look at initiating any counseling. So, generally, we do prescribe medications because we want them to first stabilize
Correct.
emotionally, mentally, even from a very severe depression. They may not speak at all, neither would they be receptive to any counseling. So the medication will at least lift their mood a bit, bring
Right.
them to a level where they open up, start expressing themselves, and then we could initiate counseling.
Right.
So counseling works when I generally ask a patient three or four things. I mean, what kind of a person are you? Would you like to open up and speak to someone and discuss things very openly, or would you be the type who wants to just listen and take advice? So
Right.
generally, I mean, there are two types of patients: one that prefer to listen to a therapist or listen to a doctor and take advice, and the one who wants like an interactive session where they talk and discuss. So it would be there. So that, based on that, of course, we decide. Apart from that, I also, very often they'll say, I think I'm not right now mentally ready to go
Right.
into a counseling like thing. Patients have that insight. So I very often tell them, okay, you first stabilize, and then we will look at counseling. And very often they say, I have been through a lot of trauma, but I am not ready to talk about it right now.
Right.
So even in such cases, then we have to probably wait. So medication plays a very important role, because one is, it works at a brain level, it changes our neurochemical makeup, and as a result, you open up a bit, your inhibitions go down, you become more amenable to suggestion, you listen,
Right.
you also become more flexible, in the sense that if someone suggests something, you don't say no, you're more open to that suggestion. And
Correct.
I think even in a therapy session, what happens is you become more communicative, you become more expressive, you also are able to talk about negative aspects and traumatic things in your life without probably breaking down as much as you would have had without
Hmm.
medication. And I
Hmm.
think finally what also happens is that you also become more receptive to the therapist's suggestions.
Right.
So medication definitely works in that way, and your focus in therapy sessions is also better. There's no doubt on that front. So medications work from that perspective, and I normally tell the patient on day one that if you're a case of depression or anxiety, you would have to take medication for at least maybe a year and a half, or 2 years, based on
Okay.
whether this is your first episode or second episode or third episode. We, the duration would differ. In a patient with schizophrenia, I very clearly tell them that it's a long term illness, and you will need medication for at least probably 5 years. So I'm saying, if we are lucky, we would reduce it earlier. So keep mentally prepared that you're going to take long term medication. So even if you're going to start medication, don't think that this is malaria or dengue, that it's a 15-day course and you're going to be fine. Or don't
Correct.
think that
Correct. Yeah.
it is a medical illness that you have a 1 month course and you're fine. I tell them, even an illness like TB has a 9 month course of medication. So
So
this is a
true.
psychiatric problem. So there is a 1.5 year course of medication that you have to take. And I tell them, we'll taper the medication. We initially may start with more medication, taper it down. We stabilize you on probably 2 or 3 medicines, and you will be maintained on that. But
Right.
also remember that it's not that you keep blindly taking the medication. So we have to review month by month. You have to
Right.
follow up. If you feel changes have to be made, changes will be made. And we tell them, this is not like, again, like malaria, TB, or dengue, that there's a course that fits everyone. No, this is highly individualized treatment. So we have to see which medicine suits which person. So for example, I give them an example of, say, Benadryl cough syrup. I tell them, some people feel sleepy with it, some
Mhm.
people do not feel sleepy with it. Or for Cetirizine, that everyone knows is used in cold, some people
Right.
tolerate it, some don't tolerate it. Similarly, psychiatric medications, the effects are highly individual. Some
Right.
people show very good response, some may show moderate response, some may show no response, and then we may change medication. So we have to monitor. So this is something which I tell them is very essential. Another thing I request them is that please give your doctor at least around 8 weeks time, before deciding he's no good. Don't just, go to your doctor for 2 weeks and then, shift to your doctor every 2 weeks. If
Correct.
you're going to do that, you will never really benefit. So,
Absolutely.
the medicines will take at least a month or two to work. So stick with your doctor. So if you don't do well, you can blame him. And if you do well, you can thank him. Both ways, you can, remain. So it's
Yes.
important that, you remain with the same doctor. Even with counseling, I tell them,
Right.
please stick for at least 3 to 4 months with a counselor, and,
Yes.
regularly go for counseling. So don't just go for 2 sessions and say, no, the counselor was not good or whatever. Yes, I always tell them it can happen. Counseling is a very human process. You may go for a session or two and feel that I'm not liking that counselor, I'm not very comfortable. That can happen. I said, even if you come to me, it can happen that, you're not very comfortable with me. You may find me too imposing, or you may find me, at times, no, I don't just gel with you for some reason. Well, then there are options available. But
Right.
if you don't go regularly, and then or you don't follow the exercises they're asking you to do at home, and then you expect results to come,
Correct.
it's not going to happen. I tell them it's like
Absolutely.
physiotherapy. You may go once a week or twice a week, but you have to do those exercises every day at home. Only then
Right.
it's going to help you. So this is, I mean, my own way of probably telling them. So the first time I meet them, I mean, I generally slot out like a 45-minute 1 hour session for a new patient, and I tell them that there are a lot of things we're going to talk to you about, so that
Okay.
a lot of time in the follow up is not wasted, that you didn't tell us this or you didn't tell us that. So I tell them, on day one,
Very
I prefer to put all the cards before you, so that you have a choice.
correct.
So, and then there are some patients who say, no, we don't want to go for medication right now. So I tell them, there are some of you who I feel need medication, there's no
Hmm.
alternative. So then
Hmm.
I tell them very clearly ki you have to go for medication. But
Right.
then there are some who say, okay, I mean, do you think I can manage with counseling, or I would like to try for a month or
Hmm.
month and a half with counseling and then consider medication? Then
Hmm.
I tell them, fine. I mean, we'll go with you if your case is not very severe based on my assessment. But if
Right.
I feel it's severe, I'll say, no, I think at least one tablet at night you start along with counseling, something
Right.
like that. So it's the list of medication that worries them. I'll be on 3 or 4 medications. So I tell them, take one medicine, start with one.
Right.
We may increase it once you, and I think once the patient feels a little better with medication,
Right.
his confidence in your treatment also comes, and his
Absolutely.
confidence in the fact that medicines work come. And
Correct.
then I think he becomes more and more amenable to adjustments in medication. Yeah.
Absolutely. Absolutely. So thank you so much. I think it's along with the confidence in the doctor, they also start developing in the confidence in themselves as well. That yes, this is working and I can get better. Probably that acts as a super good motivation as well for them to continue after that.
Another thing I would just state here, see, a lot of patients feel that, the psychiatrist only speaks. He
Hmm.
doesn't really, probably, check me up or assess me, or, whatever. So
Hmm.
I always say that, whenever any patient comes to me, it's like I personally check their pulse, I personally check their blood pressure. So,
Right.
that medical model remains, that, I am, even and in India, what happens is, कि doctor ने मुझे छुआ भी नहीं. That's a very common thing that people have. He only saw me and prescribed. So generally, what I do is I check their blood pressure, and which is, I feel we must anyway. We must. So I generally check it. I check their pulse, so that you come to know, and I just put a stetho. I mean, and examine them like a routine examination, which I think is essential, because anyone who's complaining of anxiety and breathlessness, I would just want to put a stetho to rule out
Correct.
anything medical. So they at least feel that you check them up and then have labeled them as being psychological. Otherwise,
Yes.
they feel that you just directly told them that you have a psychiatric problem or whatever. And
So
they very
true.
often ask you. I mean, this I learned a little early in my practice, because patients would say कि आपने देखा नहीं, तपासा नहीं, सिर्फ ऐसे ही बोल रहे. So then I realized that patients probably feel more confident, and then they feel you're a doctor, you're not. I mean, they generally otherwise get confused that there's no stetho, there's nothing. I mean, how come he's a doctor? In India
Absolutely.
particularly, that concept is there.
Yes, I so agree with you on that. And I think it's a fantastic strategy that you are taking, and I think that also builds confidence, when you
Yeah,
at
so
one go
even, I mean,
immediately.
I don't mind sharing it here. Like, even if while you're taking his pulse or his blood pressure, if you tell him, see, don't worry, this is nothing big, it can get okay or whatever.
Right.
The fact that you're near him, and you're
Hmm.
practically holding his hand, not holding his hand actually, but taking his pulse, and telling him, it's
Right.
like a reassuring thing to him that I'm going to be fine. So
Absolutely.
he does feel better, when you do that,
So
rather than
true.
just sitting across the table and telling him.
Yes. So that looks formal, and this looks very, that
Yeah,
inclusive, basically, right?
yeah.
So So fantastic approach. Thank you so much. Thank you so much for that view.